you how you're going to help me in this, so forgive if I've caught you on the off foot.
I hope you have a name tag.
Dr. Dow, do you want to come up? We wanted, especially in this year where our symposium and Healthy Seminars Symposium are bringing extraordinary resources to you, we wanted to recognize Dr. Brown for his contributions, not only to our integrative pursuit of this wonderful medicine, but also for his contributions in education. Dr. Lau, I'll let you make any further comments.
Sure.
He doesn't.
We have, for this year, inaugurated partly using the anniversary as an excuse, we want to start a lot of things, but we have inaugurated a Your Son YSU Integrative Leadership Award, and I think there's no more fitting person this year than Ron Brown, founder of the seminars, who has over the years tirelessly promoted integrative medicine, specifically integrative reproductive medicine and women's health. So it's my pleasure to invite our founder, Dr. Dao Xingyi, to present this inaugural Yosan University Integrative Leadership Award to Ron Brown. So,
You gotta wait for 1 minute.
Okay. You want the mic?
I want to say that Dr. Brown has been instrumental in bringing fertility medicine to basically this Western world, in the sense that he really disseminated so much educational material, not just through his symposiums in the Vancouver area, but also all the healthy seminars online. If you don't know him, you should know him. He really put his passion into his work. And what he has done for the integrated fertility and reproductive medicine for Chinese medicine is enormous. I can't really begin to tell you the amazing things that he has done. But this is really a token of appreciation from Yosan University for somebody who works so hard in the field and not necessarily recognized. He's very recognized, but I'm going to recognize him even more. Okay, you get it.
Congratulations. Yes.
Thank you.
Okay. Thank you. This is an honor. Thank you very much. Thank you. Now let's learn. That's what we love to do.
Thank you. All right. For those of you who are here live, you will find bios of our speakers here. And in the interest of putting them on stage, first and foremost, I'm going to keep my comments very brief. Dr. Dao Xingyi, needs no real introduction to anyone in TCM. His contributions over the years are well known, but if you would like to read his bio, it's in this book, or you can look it up in the resources online. Okay? Dr. Dao Xingyi.
Thank you. Sorry, I'm going to just clip on. Can you hear me well? Yeah. Okay, great. Okay, it's got a little vibration here. Lower, okay. So thank you so much for your participation this morning. And my topic is going to be on endometrial receptivity. This area of work has been going on obviously for many years in both Chinese and Western medicine. So today we're going to explore a little bit some of the technicalities and also how the Chinese medicine perspective look at this whole process of receptivity. Basically, there are several things that we want to look at. We want to take a look at what's the requirement for the successful implantation of embryo. And we're going to take a look at some of the new diagnostic evaluation of endometrial receptivity. You probably have heard of it, ERAs, Receptiva tests, and as well as other things such as EFTs. So it's kind of important to take a look at what our counterpart are doing in the Western world in dealing with some of these diagnostic tools. And we want to take a look at some of the treatment strategies in Chinese medicine and also familiarize with some of the things that Western medicine's been doing. So the incidence of infertility, I don't have to tell you this, increase yearly by year in the worldwide. Obviously has a lot to do with we are basically having children late. And the widespread use of the ART has been very helpful. And so it's, we continue to develop in this area, scientists continue to develop in this area, and it improves the area, especially in fertilization, as well as the cleavage rate every year. Still, many of the patients who has high quality embryo, especially after PGT, they still don't get very good result. We call that RIF, repeated implantation failure. So we'll take a look at that together. And the spontaneous abortion rate after pregnancy is still over 50%. So it's still pretty high. And we are not out of the woods in some ways, not a slam dunk process. If we take a look at the International Committee for Monitoring Assisted Reproductive Technology stats in 2007, overall out of 1 million procedure that's evaluated, you are looking at the overall delivery rate per fresh aspiration was about 20.3%. And for frozen embryo transfer, it's about 18.4 with a cumulative delivery rate of 25.8%. Now, this is a 2007 data. So in 2019, now 2018, that actually has been creeping upward. But still, it is still quite a bit of losses here. So 50 to 75% of pregnancy losses are due to implanting failures. And this is obviously in the ART world. But also in a natural, trying to get pregnant naturally, this also occurs quite a bit. This is something that we want to take a look. The study have confirmed that 2/3 of the implantation failure are due to this very low or low endometrial receptivity issue. So we want to take a look at how we can improve the ER to increase the pregnancy rate. So there's some basics, and some of these might be a review for you, and some of these obviously is still an ongoing process. So as we know, the uterus as a wound, it's basically a pear-shaped muscular organ, and this is where we house the fertilized egg. Until it's ready to deliver, there's really 4 major regions. And you have the fundus region, and you have basically the top, and you have the side walls, and you have the cervix close to the cervix area, or commonly we call it isthmus of the area. And there's 3 major layers, as you probably already learned. There is the perimetrium, there's the myometrium, and now the least, there's the endometrium. So, and one of the things we deal with a lot is in the luteal phase, we really like to see the lining being thick, fluffy, so to speak, so that it's ready for endometrial receptivity. So that 3 there is there, as you can see in this diagram, and one of the most important things we want to look at, and if there's no anatomical traumatic issues or anatomical malformation issues, most of the time the implantation process occurs in the endometrium. We hope is in the endometrium, and this is where we want to take a look at carefully and see how this interaction between the embryo and the endometrium occurs, and how the body can receive and take the embryo in. If you take a look at this chart here, actually this picture, this is a normal inactive endometrium. What you will see is on the surface, you will see a cilia cell of epithelium. Basically, this is simply coated on the surface. And then these are all epithelial glands right here, very robust epithelial glands. And when it's active, when it's hormonal, those glands multiplies and duplicates, and it becomes very dense. And so, but in inactive, it's pretty nicely spaced out, just like in this picture. And underneath this area, this is all your stromas. And that stroma provides you all your blood supplies, provide you with all the matrix, the structures. So basically, in a period situation, menstruation period, endometrium, the top there gets shedded off every month when you're not pregnant, when you get your menstruation. But the stroma doesn't really get shed off. Stroma stays. So we call this the functional layer. It's called functionalis, or the basalis, or basal layer. So a lot of time in a DNC situation, situation, we hope DNC is non-eventful, and sometimes DNC don't just, DNC is meant to just scrape the endometrium, but sometimes in a very rare but occasional situation, you may also scrape into the basal layer. When that occurs, then you start to create a little bit of damage and scarring, and you may also create Asherman syndrome, where the endometrium refuses to grow back. These are some of the situations that we have to deal with. Also in repeated miscarriages, in repeated miscarriage situation, where that your body sheds the product of conceptions, and sometimes not, you might get infected, or you might get in a situation where maybe some part of conception remains, scars over, leukocyte activity, so therefore the lining becomes not as regular and problematic of disease. So sometimes that can also occur also as well. So it's important to take a look at some of the normal inactive. And when you look at active, you'll start to see the glands are much more dense. And not only that, if you look in the back over here, it's just pretty regular. There's very little ditches, so to speak, little ditches. But if you start looking at it, you got a lot of these empty spaces. This is all about surface area. So when an embryo comes and lands in this moon, it's not this stiff earth. It's not this stiff ground. This ground actually have ditches. So that when it lands, it might land into, say, this area where you have much more surface area and where you actually contact with the endometrium a lot greater. So therefore, there's a lot more nourishment. There's a lot more, shall we say, odds for it to stay to it, get into it. And also this hole, sometimes besides these stitches, you will see a lot of these cells have vacuoles. Vacuole means creating all these spaces where that it allows fluid to come in, allow nutrients to come in, but also allows flexibility and elasticity. Okay, it's like sportswear, compression wear. You can pull up, you can be a little bit elastic. And so there's two phases of endometrium. I think